It's Thursday, September 12th, and this is the Daily Medical News, where we bring you the day's top medical headlines and take a closer look at today's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, a new Streptococcus pyogenes variant may be the culprit behind a scarlet fever epidemic in Britain.
A federal judge blocks an abortion law in North Dakota that mirrors those in more than a dozen other states.
Tight control of psoriatic arthritis may deliver no additional advantages later.
And two treatments for uveitis may be similarly successful choices.
Plus, why statins could do double duty as antidepressants in some patients.
A new Streptococcus pyrogenes genotype that emerged in England may be the cause of an unprecedented increase in scarlet fever. A defining feature of the new genotype is an increased production of streptococcal pyrogenic exotoxin A, also known as scarlet fever or erythrogenic toxin A. In a report published in The Lancet Infectious Diseases, researchers from Imperial College London analyzed S. pyogenes genotypes from scarlet fever and invasive disease cases in 2014 to 2016. They compared them with genotypes from 2009 to 2016. The investigators found that the new genotype significantly expanded its presence in scarlet fever and invasive disease cases. By 2016, it constituted 84% of all tested samples nationally. The study authors say the expansion of that lineage within the community reservoir of S. pyogenes might explain England's recent increase in invasive infection.
A federal district court judge has temporarily blocked a North Dakota law that forces doctors to tell patients that medication abortions may be reversed, calling the measure devoid of scientific support. The North Dakota law requires that physicians inform patients at least 24 hours before a medication abortion that it may be possible to reverse the effects if they change their mind. It also mandates that doctors provide printed materials to patients with information about reversing the effects of an abortion-inducing drug. The judge said the law violates physicians' right not to speak, and it goes far beyond any informed consent laws addressed by the U.S. Supreme Court or other courts to date. The American Medical Association and the Red River Women's Clinic in Fargo, North Dakota, issued a joint legal challenge to the law. They argued that the law violates doctors' First Amendment rights that protect them from being compelled to speak against their will. At least 7 other states have passed similar laws requiring doctors to tell patients about the possibility of medication abortion reversals. Those states include Arkansas, Idaho, Kentucky, Nebraska, Oklahoma, South Dakota, and Utah.
Benefits from tight control of psoriatic arthritis may not last if patients return to standard rheumatology care. In a follow-up 5 years later, patients with psoriatic arthritis who took part in a tight control program for 48 weeks, then continued with standard care, showed no clinical advantage over patients who received usual care. The findings based on follow-up data from 110 patients in the tight control of inflammation in early psoriatic arthritis study. The findings appear in the journal Rheumatology. In the original study, significantly more adults with psoriatic arthritis who were in a tight control treat-to-target group achieved minimal disease activity criteria after 48 weeks, compared with a standard care group. University of Oxford researchers had hypothesized that clinical advantage would continue. It didn't. 5 years later, 69% of patients in the tight control group and 76% of patients in the standard care group were considered to be in low disease activity, and use of methotrexate or biologics was similar between the two groups. We'll be back with more medical news after this message.
Welcome back to the Daily Medical News. I'm Nick Andrews. Should you treat uveitis with methotrexate, or should you go with mycophenolate instead? Well, the answer is yes. Choosing either methotrexate or mycophenolate achieved inflammation control after 6 months in 2/3 of adults with uveitis, and both treatments delivered a reduction in corticosteroid use. The findings provide scientific justification that mycophenolate mofetil isn't more effective than methotrexate as a corticosteroid-sparing immunosuppressive therapy for uveitis. That's according to researchers from Aravind Eye Hospital and Postgraduate Institute of Ophthalmology in Madurai, India. The findings from their study of more than 200 uveitis patients appear in JAMA. The investigators randomized patients in India and the United States, Australia, Saudi Arabia, and Mexico to either methotrexate or mycophenolate. Overall, 67% of patients given methotrexate and 57% of those given mycophenolate achieved treatment success at 6 months. Adverse events were similar between the groups.
Could statins be repurposed as adjunctive antidepressant drugs in a subgroup of patients with major depression? It's a tantalizing prospect that's finally about to undergo rigorous testing. Dr. Christian Ota of Charity University in Berlin says the upcoming SIMCODE trial could provide a definitive answer. SIMCODE is a randomized trial to be conducted at 8 German academic medical centers. Participants must have major depressive disorder and comorbid obesity. They'll be randomized to simvastatin or placebo on top of standard antidepressant therapy. Speaking at the annual Congress of the European College of Neuropsychopharmacology, Dr. Ota said SIMCODE will close a circle he helped open with his 2012 report from the Heart and Soul study. In Dr. Ota's study, nearly 1,000 patients with coronary heart disease were assessed annually for depressive symptoms for 6 years. The 65% of patients who were on statin therapy, albeit in non-randomized fashion, had an adjusted 38% lower risk of developing depression. Dr. Ota's study was one of 7 observational studies involving more than 9,000 patients included in a meta-analysis that showed statin users were 37% less likely to develop depression than were non-users. Dr. Ota and other researchers all agree that the verdict isn't in yet as to statins' effectiveness as adjunctive antidepressants. The subgroup of patients with major depression who are most likely to gain are those with what the researchers variously described as comorbid cardiometabolic disease or immune metabolic disease, or more simply, as SIMCODE calls it, obesity. These are patients with a high degree of systemic inflammation, which often makes their depression less responsive to standard antidepressant therapies. The working hypothesis is that the statin's anti-inflammatory effects will result in a greater response to conventional antidepressants. And that's it for today's Daily Medical News. Be sure to listen to the latest episodes of the Dermatology Weekly and Blood and Cancer podcasts, available today and every Thursday. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Thanks for listening to the MD Edge Daily Medical News.